Hello, friends. This is Dr. Gupta, and today, as you have seen the slide, we are talking about the treatment of premature ejaculation. Yes, friends, the most common sexual disorder around the world is premature ejaculation. One estimate says that around 70% of men do suffer from this problem, either in a long-term basis or in a short-term basis. But the problem is something which every man has to face. So its treatment and its knowledge about it is very important. As you know, the patients or the people who suffer from premature ejaculation are very disturbed and loses their sexual self-confidence. Why they are disturbed and loses their self-confidence? Because for a man to unable to satisfy his wife is a very big ego issue, ego problem. So his ego gets hurt. As a result, he loses his confidence on bed. He also loses his desire for sex and he starts avoiding meeting with his wife. And that leads to friction between the partners. Now, let us discuss what are the common causes of premature ejaculation. One of the commonest cause is a premature ejaculation is a learned behavior for some. Boys, they get the sensation of sex when while urinating, touching their penis, and they have a habit of quickly ejaculate in the safe or private area. Most boys don't have their own room of their own, so they go to the toilets and quickly masturbate. So that is one of the commonest reason because that makes the body habituated to early ejaculation. Besides this problem of masturbation, porn addiction, the people who watches more porn are always so horny and so excited that they ejaculate very fast. Then comes the anxiety of performance. See, you have got a problem, you're not 100% confident of performing, you may ejaculate early. Metabolic diseases like diabetes, thyroid, hypertension, cholesterol, fatty liver, all this can lead to uh, debility and early ejaculation. Another important point is low serotonin in the brain because such some people are too ambitious. They are always working on the project, finishing the project, they are in stress or using their brain excessively, they go low on serotonin in the brain. And low serotonin levels in the brain is a known factor and confirmed factor scientifically that it can lead to early ejaculation. Next point is that complete or incomplete knowledge about the men and women genitalia. What happens? Some people have got a difficulty in penetration as they do not have any much idea about that anatomy of sex. Therefore, they can come out fast and sometimes some drugs can make you come out fast, and if you do a sex very infrequently, say once in a month or after a long gap, you will come out fast. Now, let's talk about the treatment of premature ejaculation. At home, you can do Kegels exercise. If it helps, well and good. If it doesn't, then you have to go for the second stage. What are Kegel exercise? We recommend three types of Kegel exercise. One is called hip raise, as you can see in the picture. Second is a leg raise, that you are raising your leg against the wall. And third is you are activating your pelvic muscles by holding the urine midway. While you are urinating, after some urine is passed, you hold, control that urine, stop that urine and release again. Stop and release again. Then you will know which muscles to contract, and you can practice contracting such muscles more than 100 times a day. This works in some cases. If it doesn't work, then you have to go into the mindful sex. Mindful sex we teach in details when we go for the sex counseling. Mindful sex basically means that you are aware of your sexual feelings and sensations. The minute you find that the sexual sensations are rising high, you can stop. You can let that rising sensation to calm down and then restart. Second is understanding the point of no control. Meaning is that you have got to understand at which point of time you cannot control the ejaculation. And stop and start and squeeze technique are two things. Stop and start technique means you just penetrate 4, 5 strokes. You stop for 5 or 10 seconds, again restart, again stop, again restart. So that is called stop and start technique. Squeeze technique, that is where is that when you are about to come, by doing the mindful sex, when you what is the time that you are about to come, you can hold the glance by the first finger and the thumb below and the finger up, press the glance for 2 or 3 seconds, leave it, press and leave it, press and leave it, and that again also slows down the ejaculatory reflexes. So these are the common techniques of treatment which you have to do it on your own at your place. As we said, that once you do the Kegel exercises, mindful sex, stop and start, squeeze technique, when you incorporate all this and still you can't get a desired result, then we have to go to the medications. One is the serum reuptake inhibitors, serotonin reuptake inhibitors. These are the medicines which increases the serotonin levels in the brain and they prolong the time. And this is a very proven fact that SSRIs are the drug of choice in treating a premature ejaculation. There are certain Ayurvedic medicines also like conch page, Kamini Vrindavan Ras, and these are the things which can suppress the ejaculation and increase the time. Now, counseling is very important. The first thing is that we ask whether he is doing the mindful sex or not. See, sex comes with an imagination behind of wonderful feelings. So you have to control your mindfulness and control your thinking about sex. Second is the cognitive behavior therapy. Don't get worried that if your woman touches your penis or if you're uncomfortable with your partner, get a therapy for tell us and we can solve these things. If you have a relationship problem that you know that your wife will get angry if you come out fast, so we can talk it out and solve this. And if you do a long foreplay, say like some people said they do a foreplay of 15, 20, 30 minutes and then they insert and they ejaculate. So if you do a long foreplay, the erection penis is standing for a long time. It's not able, cannot hold the erection for long. It comes out fast. So reduce your foreplay time and increase the afterplay time. Also take the help of physiotherapy. Physiotherapy is basically IFT, Faraday therapy. In this, the impulse which is to ejaculate, that is the nerves taking the information to the brain for ejaculation, their excitement and movement gets slowed. Physiotherapy IFT also strengthens the penis muscles and they can stay erect for long. What happens in many cases is that even if they are not ejaculating, they are losing the erection. So, in order to prevent this complication of treatment, we also suggest physiotherapies which strengthens the penis to stay erect for a long time. Treatment of premature ejaculation is a difficult treatment because it is not like malaria or something where the medicine is assigned to a person. If you take SSRI for a long time, you are in danger of losing your sex desire. Then sometimes these SSRIs also don't work in many cases because sex is a instinctive action. So to bring good results, we have to add many treatments together. Like once we take the history and once we give the counseling, we understand that what are the combination of treatment will help, whether it's premature Kegel's exercise, or whether it is just stop and start, or it needs medicines. If medicines is required, then what kind of a medicine? So what kind of medicine has to be decided in by knowing his erection factor also, knowing his frequency factor also. So we suggest a combination of medicines, and with the combination of therapies like physiotherapy, home exercises, medicines, counseling, we are getting very good results. And both me and Dr. Anindita Chaudhary, we have solved thousands and thousands of such cases. And not only that, our we have able to help them with a longer time. Our treatment, because of this mixing of therapies, is also gets a long term result to the patient. Say if you take only SSRI, so you will get a long time, but once you stop the medicine, the time comes back to earlier position. So that does not happens when we mix several therapy, and this is what is our USP is that our results are long standing results, not just short result, medicine based results. Thank you.